Health Organization is updating COVID-19 developments in Africa. Leading the discussion is the organization's regional director for the continent. That's Dr. Matshidiso Moeti. Our reporter Heidi Giokos has been following that briefing a short while ago. She's now joining us here live on Today. Heidi, a very good afternoon to you, and thank you very much for being here. We're finally getting more pieces to complete the picture of what we know about Omicron. I see also Discovery Health has released some data. What do we know?
Yes, certainly, Bradan. I think this is big news coming from Discovery Health. And the reason for this is because we've been constantly told since the emergence of Omicron that there's very little information. It's very difficult to say how serious this virus is. But Discovery Health trying to put the pieces together for us. And what we do know is that this variant is highly transmissible, but it seems as though it's a lot milder than previous variants and previous waves South Africa has experienced. The concern still is that once you've been infected before with other variants, or during other waves, there's a possibility that you might be reinfected. The big news that I think many South Africans were waiting to hear is the effectiveness around vaccines and whether or not the vaccines we are using currently in South Africa, which is Johnson & Johnson and Pfizer, actually work against Omicron variants. The information that's come through from Discovery Health is that vaccine effectiveness of the double dose of Pfizer has reduced from 80% to 33% in Omicron against COVID-19 infection and reinfection. The big one, though, that of course health experts and even the eNCC will be looking at very closely is what is happening in our hospitals and whether or not people are falling severely ill. The protection and effectiveness of 2 Pfizer shots against Omicron. Previously with Delta, there was 93% effectiveness and coverage against severe COVID-19. With Omicron, it's dropped down to 70% against severe complications and possible death linked to Omicron. There's still some protection, and Discovery Health alluding to the fact that what we've been hearing constantly, that vaccines are possibly the only tool that we have right now, and this is possibly why we're seeing such a milder wave and a variant this time around because of what the vaccines are actually doing. But let's listen to the CEO of Discovery Health, Ryan Noach.
In terms of the vaccine effectiveness of the double dose of the Pfizer-BioNTech regime, the vaccine effectiveness has reduced from 80% in the Delta wave to 33% now in this Omicron wave against COVID-19 infection, quite a material reduction. But the vaccines were developed to prevent severe illness and death. And what is very encouraging is that the vaccine effectiveness of this double dose of Pfizer-BioNTech holds at 70% in the Omicron wave against severe complications of COVID-19, which we measure by hospital admissions. So 70% vaccine effectiveness in mitigation of hospital admissions.
Heidi, is there concern about children being hospitalized?
Yes, there is a concern about children being hospitalized. Discovery Health has been able to find that children to date have had a 20% higher risk of admission with Omicron variants. What's also interesting here, Bradan, is that many people that have been hospitalized during the 4th wave, it's been by chance that they have been able to pick up that they have COVID-19 because they were probably hospitalized for other reasons or for surgery purposes, and because of routine, they tested for COVID and found that they have COVID-19. There was a worry about those under the age of 5 testing positive and being admitted. It has a lot to do with the admissions of vaccines and how vaccines have not been administered in that particular age group. But Discovery Health, something that we have also heard from the NICD, saying that this is nothing to be too alarmed about. It is a worrying picture, but they are monitoring very closely. And the silver lining in all of this is that it's still very mild. If I'm not mistaken, it's only about 10 to 11% of those actually admitted, not just children, but those actually admitted during this 4th wave need oxygen or ventilators. So it's nothing compared to what we saw with Delta. Let's listen to Ryan Noach again.
Children during this wave, as reported by the National Institute of Communicable Diseases here in South Africa, seem to be at 20% greater risk of hospitalization during the wave. It's important, though, that I say they are experiencing very low test positivity rates relative to adults. And in absolute terms, the admission of children to hospital remains very low. And so there is no reason to panic in this regard, without question.
Okay, Heidi, now the World Health Organization, that's the WHO, has also been having its last briefing, I understand, for 2021. And this is coming, of course, at a time when there's still a lot of uncertainty around Omicron. I mean, we can tell even from this Discovery Health's findings.
Yes, certainly. And I think the biggest message that's coming out of 2021 and the message from the World Health Organization is around the discrimination that many African countries are experiencing because of these travel bans that have been imposed by various countries because of Omicron and the supposed emergence of this variant. The World Health Organization has reiterated time and time again that it's very difficult to pinpoint where a variant emerges from, but rather global partners should hold hands and work together to try and fight this pandemic. Another big issue that the World Health Organization is hoping will improve in 2022. Hopefully there is no pandemic as severe as this in 2022, but the accessibility and availability of COVID-19 vaccines. We know the African continent has truly been last in line to get these vaccines, and the World Health Organization saying that because the vaccines are a tool to fight off this pandemic, and other countries already speaking about a fourth booster vaccine shot, whereas some African countries haven't even administered one vaccine shot. It's a conversation that needs to change and needs to include all countries, and no country should be discriminated, because at the end of the day, if the African continent has been last in line to have vaccines administered, they should not be treated this way when there's a new variant and this variant is highly transmissible.
Yeah, no, thank you very much, Heidi Giokos there. And I'm hoping this hour to be speaking to the Minister of Health, Dr. Joe Phaahla. I understand he just got his second Johnson & Johnson jab earlier today. Okay, he was waiting in line because I think this week the plan was to finish the healthcare workers J&J booster shots. We'll speak to the Minister about that experience later on.